Cystoid macular edema, it sounds like a complicated term, but it really isn't if you break it down. Cystoid means there are cystic spaces, and a cyst is just a fluid-filled sac, effectively. Macular, that's the central portion of the retina, and that is the central area which is the most important. So when you're looking at the TV screen, when you're looking at me now, you're using your macula. And edema just means fluid, so when you get swollen legs, you have edema. And in the retina, the edema is the fluid which fills the cyst, forms the cyst. Inevitably, the vision goes down. It can occur spontaneously or for other reasons, but it is reasonably common after cataract surgery for it to happen. It's usually subclinical though, so it doesn't really affect you, but in some patients it can be clinical. The typical history is the vision starts off okay, and then over a sort of 2-week period it deteriorates. So you have the operation, you're delighted with your vision, and then suddenly 2 weeks later you think things are a little bit cloudy. The cloudiness can increase and the visual clarity can just be soft focus. You often go to your follow-up or to your optician, and then they check you, and then they find that there's swelling at the back, and it's called cystoid macular edema. We do something called an OCT scan, an ocular coherence tomography scan, where you sit in a machine and they take clever scans, and that picks up the thickness of the retina. We can actually see the fluid-filled cyst, we can actually see the retina thickening. How do we treat it? Well, it's actually a self-limiting condition in the vast majority of cases, but it can take a couple of months to disappear fully, and we don't like to leave the retina swollen for a couple of months, so there's a hierarchy of treatment. The most common treatment is that we start you up on the steroids again if you've already stopped them, and we give you some non-steroidal anti-inflammatory drops. Those non-steroidal anti-inflammatory drops have a direct effect on the macula and can help shrink it away. Typically, it can take 6 to 8 weeks to fully resolve. We want to make sure it fully resolves before we leave you alone. If it doesn't resolve, there are other things that can be done. We can give injections around the eye of a steroid in order to minimize the inflammation, because we think it's an inflammatory process happening. If that doesn't work, we can actually give steroid implants into the eye or even other injections into the eye. Only a very small minority of patients need that sort of intervention, but in the majority of people it settles down. It's important though to know if it happens in your first eye, it's more likely to happen in your second eye. So it's important you discuss it with your surgeon and make sure your surgeon knows exactly that you had the cystoid macular edema, the swelling at the back of the eye. Because what we can do is we can give you those non-steroidal anti-inflammatory drops preemptively to make sure that you're okay and minimise the risk of it happening.